welcome back to another episode about talking about interesting things and things in life that affect others. So today we're talking about schizophrenia, and we have a special guest, Dr. Sherbert, who is specializing in mental health illness and specialty of schizophrenia, which is what we are talking about today. So, Dr. Sherbert, what is schizophrenia?
Well, let's begin. So basically, schizophrenia is a serious mental illness, as you may have probably heard, and it affects how a person thinks, how a person feels, and how he behaves. Person with schizophrenia, they may seem like they're distressed, and it can be very stressful for them and their families. I will put it in a good example. If I was sitting here, I see an imaginary person, or I see something that completely isn't true. That would be an example of schizophrenia.
All right. And what are the causes of this terrible illness?
So, it's very complex and it's a very serious and complex illness. There's many ways it can happen. For instance, let's talk about, well, as far as we know so far from our current understanding, this is a combination of genetics, environment, and the neurochemical factors which contribute to the development of schizophrenia. And there are many risks involved, obviously, but let's go over the list that I just mentioned earlier. Let's start with genetic factors. The genetic component to schizophrenia, obviously, just like most other mental illnesses, it runs in the family. However, specific genes, however, it actually associates with schizophrenia, but it's not been defined very well with our current research. There's also another thing is brain chemistry. As you know, your brain is full of neurons, chemicals, and stuff. How a chemical works and structures, it basically makes how your brain think in a certain way. So firstly, imbalances in certain brain chemicals such as dopamine, glutamate, that may play a very important role in the development of schizophrenia. Structural abnormalities in the brain, for example, if your brain is like weirdly shaped, enlarged ventricles, or reduced gray matter volume, these things can also contribute to schizophrenia. And also another thing that's worth mentioning on the list is neurodevelopmental factors. Schizophrenia is thought to involve disruptions in the brain development during early childhood or adolescence, abnormalities in neural circularity, synapse running. These are all very good examples of neurodevelopment. So when you're growing up, if you experience like trauma to a head or other stuff similar, you might get a higher chance of getting schizophrenia. Obviously, another thing that could cause schizophrenia, which isn't as common, would be substance abuse. So, substance abuse, particularly cannabis, it's been associated with a higher risk, not cause, but higher risk of getting schizophrenia. And yeah.
All right. And so, what are the consequences of schizophrenia?
Oh, there are many consequences with schizophrenia. Let's start with the first consequence. It's called psychotic symptoms. For example, like since you, as may everyone, if you have a basic knowledge of schizophrenia, you probably know schizophrenia. It's characterized by the presence of psychotic symptoms. These symptoms, they can include hallucinations, seeing things that is not actually there, like I mentioned earlier, delusions, or holding false beliefs. These experiences, they can be distressing, confusing, and disruptive to daily life.
All right, and would schizophrenia have a cognitive impact on individuals?
That's a very good question. Well, obviously it does. Many individuals actually with schizophrenia, they experience cognitive impairments, like you mentioned. It can affect their ability to think clearly, to concentrate, to remember information, and make decisions. This can impact their academic or work performance, making it challenging to maintain employment or pursue education.
And does it also affect social and occupational or like emotional and behavior, like things that we use in the society, like daily lives?
Oh yeah, of course, obviously, yeah. For instance, schizophrenia victims, they often lead to difficulties in social and occupational functioning. Individuals with schizophrenia, they may struggle to maintain, relationships, find and keep employment, participate in social activities, like mentioned before, right? This can result in, social isolation, reduced opportunities for personal growth, and, financial problems. And as these things happen, it's just like a snowball of effects. When you start isolating yourself or you can't find a job, schizophrenia effect might actually get worse. So, it's like a domino effect. One thing leads to another, and it just gets worse and worse.
All right. And so, what are like some of the symptoms someone might exhibit with schizophrenia?
Well, like I mentioned, there's a lot of problems with schizophrenia. People with schizophrenia, they will face a lot of mood like disturbances. For example, depression, anxiety. They may exhibit changes in behavior. For example, like social withdrawal. I don't want to hang out with people. Apathy. Disorganization, and overall bizarre behavior. You're facing like illusions and stuff. Obviously, you'll face a lot of bizarre behavior what other people perceive as strange. So yeah.
Can you please elaborate on some of the symptoms?
Oh yeah, well, let's begin with the most important one. As everyone knows, schizophrenia is basically tied directly with the word hallucinations. They perceive images that are not actually present, such as hearing voices, seeing visions, or feeling sensations on the body randomly. So let's go over like what these hallucinations will be. Let's start with delusions, okay? So holding fixed false beliefs that are not based in reality. But delusions, it can make you paranoid. Things that will never happen, you begin to still feel it. And another thing about hallucinations would be, disorganization, thinking and speech. For instance, you're disorganized. Your speech might be slurred. You might speak slowly. The stuff that comes that you think of in your head when you bring it out, it's like all gibberish when other people hear it. Another thing is, reduce emotional expressions. This person might be like unemotional at all. You might tell him or her a joke, or tell him or her a very bad thing that happened. This person might not, experience any emotions at all. They can seem very cold, or they can seem too emotional actually. And another thing that is very prevalent with schizophrenia will be social withdrawal. Like mentioned before, with people with schizophrenia, they will withdraw from social interactions and experience a decreased interest, in connecting with others.
I know, as many parents and stuff they wonder what are the cognitive symptoms of people with schizophrenia?
Well, some cognitive symptoms would be, impaired memory and attention. Experiencing difficulties with memory, remembering things. Like I mentioned, also attention and failing to concentrate, which will lead to work problems and as well as like school problems. I know that this can overall affect learning, problem solving, and decision making in general. So another thing that's considered a cognitive symptom will be that overall executive like dysfunction. So what this means, it's a very big word, but it's very simple what it means. So basically, a person with schizophrenia just struggles with executive functioning skills, such as planning in general, organizing, prioritizing, and starting tasks, stuff like that. Another thing that will happen will be impaired working memory. You will have problems remembering your memories. You'll have false memories and your real memories. They'll be all mixed together, and you won't be able to tell what is real and what is not. And yeah, just stuff like that.
That sounds pretty terrible. I think a lot of people also wonder, like, what is the age of onset for schizophrenia? Like, what is the most common age that people get schizophrenia?
Well, it's a very good question. Well, obviously, like all the other mental illnesses, the age of onset, it varies, it's different from person to person, setting to setting, but it's most commonly emerges in the late adolescence or, early adulthood. The typical age range for the onset of schizophrenia symptoms is, late teens to early 30s, with the average age of onset being the early to mid 20s for males and late 20s for females. It is different for male and female. However, it's very important to know that schizophrenia can also develop in childhood or later on in life. But although these cases are less common, like I said, it's like late teenage to like early 20s would be the most prevalent time for the onset of schizophrenia.
All right, and is schizophrenia treatable? Like, what are some examples of treatment for schizophrenia?
Well, like I mentioned before, schizophrenia it's a chronic condition that requires long-term treatment and management. You can't just take a pill and it will be gone by next day. It will take a long time. The primary goals of treatment is to reduce control of symptoms. You can't truly get rid of it. You can just reduce how the symptoms will affect you, and try to improve the quality of life for those victims. And let's go through a list. Well, firstly, there's medications. Certain medications will help reduce like the effects of schizophrenia, as well as overall, just in general, make the symptoms slightly more manageable, and you can begin to recover better. Well, not recover, you can begin to perform better and stuff, but you will never be able to truly recover from schizophrenia. Another method that is commonly used is psychosocial interventions. So there are many. So basically, this is used in combination with medicine. Well, I think in most cases it will be used in most with alongside medication to support individuals with schizophrenia. These interventions, it can help with managing symptoms. It can enhance coping skills, improve social functioning, and promoting recovery. And another thing that could help will be lifestyle and self-care changes. Engaging in healthy lifestyle practices can support overall well-being of an individual with schizophrenia. These are probably things you should be doing anyways, which include maintain a balanced diet, regular exercise, adequate sleep, avoiding substance abuse, and overall managing stress. Overall, I guess in a summary for this treatment for schizophrenia or decrease of symptoms is, I'll give it a good summary. It's obviously crucial with individuals with schizophrenia. Work closely with a mental health profession to develop an individual treatment plan that works for this individual. And you can't just go to a doctor and just forget about it. It just has to be a continuous process. Treatment, it may involve a multidisciplinary team approach, including psychiatrists, psychologists, social workers, and overall healthcare providers. You need a whole team to manage these things. Regular monitoring, medication adjustments, and ongoing support. It's very important to optimize outcomes and improve the individual's quality of life.
And so what are some of the side effects of the treatments that you listed earlier, like the medications and stuff?
Well, with most medications, there will probably be side effects, but I would personally say that these side effects are more manageable compared to the effects of schizophrenia. Well, let's talk about three major consequences of these side effects of these medications. So obviously there'll be weight gain. These medications, they increase appetite and will overall lead to weight gain, which might contribute to other health concerns. But these health concerns will probably be less prevalent compared to the symptoms of schizophrenia. Another thing that could happen, which is like I mentioned, weight gain. It's called with weight gain, you get increased blood sugar, and some people would say that raising blood sugar is you're at risk of developing diabetes and stuff. But I would argue that these side effects are pretty much negligible compared to the symptoms of schizophrenia. Another one, like I said, would be this one's a little more than the previous mention. Weight gain and high blood sugar. This will be Parkinson's, another disease where you don't remember things because these medications include caffeine and stuff like that. This will lead to the onset of Parkinson's later on in life.
Yeah, and Parkinsonism is also characterized by tremors, rigidity, and bradykinesia. All right, well, that was very, very informative. Thank you very much, Dr. Sherbert. I hope this podcast lets you all know a lot about schizophrenia, and to always go to mental health professionals if you or someone you know you think suffering from schizophrenia.
Yeah, don't be afraid to reach out.